I'm Dr. Gary Churchill, a facial plastic surgeon at the Center for Facial Plastic Surgery. One thing that happens as we get older, and it happens in almost everybody, is that the cheeks get saggy and form jowls, and the neck can also get loose and kind of hang down. If this is happening to you, you may be considering a facelift. The procedure is performed under twilight anesthetic, which we do right here in our outpatient facility. The Center for Facial Plastic Surgery is an outpatient surgical facility where we perform all of our surgical procedures. I perform facelifts on both men and women, and the age range can be from late 40s until the 80s. What separates me from other physicians doing this procedure is that I use a different technique, and over the years I've developed my incision so that I maintain a natural hairline while hiding the incision completely once it's healed. In a facelift, the first step is making an incision under the chin, as well as around each ear, and through those incisions, the tissue is tightened. The first tissue we tighten is in the neck. The tissue of the neck consists of 3 different layers. The outer layer is the skin, underneath that is fat, and beneath that is a muscle. So all 3 of those tissues contribute to the sagging of the neck. So it's not just the skin. Through that incision, we liposuction the neck. That removes the excess fat beneath the skin. That also exposes the muscle underneath. The muscle is then tightened. Then I suture the muscle together in the midline using dissolving sutures. Once the muscle is tight and the fat is removed, I close the incision. However, at this point, the skin is still loose. So the way I get the skin out of the neck is by lifting it into the cheek and behind the ears. Next, I turn the head to the left side and I start on the right cheek. I make an incision that starts up underneath the hair, curves around to where the hairline meets the top of the ear. Then I hug the contours of the ear and go behind the cartilage at the ear canal down to the bottom of the earlobe. The incision then carries up on the crease of the back of the ear so it's well hidden. We actually tighten the cheek and the neck in 2 layers using that incision that goes around the ear. We want to tighten the jowl tissue by tightening the deeper layer under the skin with dissolving sutures. We also redrape the skin in an upward and slightly backward position as well. We're taking really great care that it doesn't look pulled or tightened too much to distort the mouth or any of the other facial structures. The excess skin is trimmed off, and then the incisions are closed with dissolving sutures. This is a 3-hour procedure that's performed right here in the office, and patients go home right afterwards. When patients leave the office, there's a head wrap placed with cotton padding underneath. That keeps pressure on the cheeks and on the neck to prevent bruising and swelling. Patients are concerned that a facelift is a big surgery to have as an outpatient. However, facial surgery is not that traumatizing to the body. That's why you can go home within an hour from having the surgery done. Because this procedure is performed under twilight anesthetic, there's absolutely no sensation or memory of the procedure whatsoever on the patient's part. Afterwards, it does feel tight because the pressure dressing is on there and the tissues have been tightened, but most patients don't really have significant pain from the procedure. The morning after surgery, patients return to the office and the bandages are removed and all the incisions are cleaned. There's usually some swelling and bruising, and that resolves typically in 10 days to 2 weeks. With any surgery, there's always a risk for infection. However, at the Center for Facial Plastic Surgery, we have a virtual 0% infection rate. Patients enjoy coming here because it's private, intimate, and they get very personalized care. We even have an overnight suite where patients can spend the night being watched by a registered nurse. I have a great staff. They've all worked here for years, and the patients love them. Most of them make personal relationships with the staff, so when they come in for their pre-op labs, they already know the people who are here, and when they come in the day of surgery, they feel like they're back with family in the office. If you have a facelift, you can expect to return to your normal daily activities in 10 days to 2 weeks. However, to have full surgical recovery could take 2 to 3 months. It's hard to say how many years younger a facelift makes someone look, but most people say they look 10, 15, even 20 years younger. The change they see is that their neck is tight and smooth, and the jowls are gone, the jawline is well defined, and the cheeks are lifted back up where they used to sag. A facelift also will smooth wrinkles that people see in their cheeks because the excess tissue has been removed. A facelift is one of the most gratifying procedures a patient can have. Patients come back and it's changed their life and they just look so much younger and refreshed that it makes a big difference in every aspect of their life. It's one of the best feelings in the world when patients come back and I see how happy they are. At the Center for Facial Plastic Surgery, all we do is facial plastic surgery. So if you're considering a facelift, you should see someone who has the experience and the expertise to give you the optimal results.